now it gives me great pleasure to welcome Margaret Foster. Margaret is the Evidence Synthesis and Scholarly Communications Librarian and the head of the Center for Systematic Reviews and Research Synthesis at the Medical Sciences Library, Texas A&M University. She is the co-author of the first book written on systematic reviews for librarians, Assembling the Pieces of a Systematic Review, a Guide for Librarians, and recently, Piecing Together Systematic Reviews and Other Evidence Synthesis. She received the Presidential Impact Award from Texas A&M University in 2018 and the Lucretia W. McClure Excellence in Education Award in 2024 from the Medical Library Association. Thank you, Margaret, again for being our guest speaker for this series and sharing your expertise. So now I'm going to stop sharing my screen and turn everything over to you.
So welcome, everybody. Thank you for joining us this afternoon. And I'm so excited to share these slides with you. And today, these are our objectives. We're going to be talking about standards for searching databases, evaluating those searches, also about selecting databases. I'm going to show you a tool that's very new to me. Just found out about it a couple weeks ago. Also get into some strategies and tools for translating your searches and deduplication. And we'll end today with a little preview of what's going to come up next week. We're going to talk a little bit about gray literature search, but that's something we're going to talk a lot more about in our next session. So this is just a little reminder of the phases of the pieces cycle and kind of where we're at. So the first 4 phases of the pieces cycle is really meant to build up to the paper, with the last 4 phases to talk about what do you do afterwards. And so we talked about in the beginning, the proposal, what's the scope of the review? And then the next part, our last time, was all about the protocol, and that's where you're answering the question of what are the methods. And a little bit about what we're talking about today. The group you're working with would probably need the first search to be finalized, and that's what we're going to be talking about for today as well. And the production phase, this is the phase I really consider where you're taking that main search, you're translating, you're doing kind of the bulk of the searching for the review, because they've really kind of worked out, okay, we're really going to do this, and here's our protocol, that kind of thing. One of the outputs you could have of that is doing some preliminary results, such as a conference or something like that. And then next time we'll be talking all about the paper and kind of finalizing everything, documenting all of your searches. And so hopefully you can kind of see that little pink wedge going from just a quarter to all the way full with the paper. In the production phase, this is where you're working through your pieces processes. So in this plan, want to think about, are we going to present our preliminary findings? Who wants to see these before we're all done? And then that identify stage, and that's pretty much what we're going to talk about today, is just the identifying stage. It's finalizing that main database. Maybe you're getting some feedback from the protocol if that was published or sent out. Really finalizing that list, translating the searches, all of those things. We're not really going to talk very much about steps 3 and 4. I think I maybe have 2 slides at the end, just a little bit about guidance that you could give. So in the planning stages of this part, it's really if they wanted to have some kind of an output, and how much are you going to present? And I usually advise groups, don't try and finish the whole thing before a conference, just present what you have. So if you've done the first database, if you've done 200 articles, whatever it is, that's what you would present there, because it's just a poster or a presentation. And it's better to do that than to rush through the review and try and have it completely finished. We all know we've had those clients where they're like, oh, I've got to do this in like 2 months or something like that. Okay, as promised, this is where we're going to spend our 90 minutes today, is talking about the identify stages. And so identify is all of those stages where you are trying to figure out what's the best way to find what they're looking for. And so this is where I'm kind of making this caveat here that probably would have finished this for the protocol, but because we had so many things to go through last time, we didn't completely talk about all the depth of developing that search. So that's why we're going to talk about it today. But I've also found sometimes, especially if the group doesn't necessarily publish or get feedback on the protocol, sometimes they'll do the protocol and then they're getting into it and then like, oh, I'm going to adjust things. So we're going to kind of talk about those things that pop up. And then we're going to get into the translating and deduping. So this first section, we're going to be talking about standards, get into the case study, and a little bit about selecting interfaces. I think there might have been some questions about that, and we didn't talk about it very much last time. So I'm using the MECR standards in here to talk about, and the thing to remember about MECR is what it was designed for. So Cochrane really focuses on randomized controlled trials and intervention studies. Now they've started, they do have a group that's now doing some qualitative studies, and I think they're now also doing systematic reviews of diagnostic testing. So they are branching out from just this type of review. But your group may have a different question. And in the protocol, in the proposal phase, we talked about 10 different questions that you could ask with the systematic review. So not all systematic reviews are going to be limited down to randomized control trials. You could do a review where you were just looking at case studies. It really depends on their question. And one question that we saw in the Padlet was also, how many studies do you have to have? There is no right number. You may go and have a great question and search for it and find no studies. You may find only 2 or 3. And that is a finding on its own. But of course, journal editors and things like that could say, no, we don't want to see that. But it's all about putting it into context. What do those results mean? So there's no right number for that. So here what I tried to do was to take those main standards that are in Cochrane's list around searching, and I kind of highlighted them here and also abbreviated them to make them a little easier to read. I also put in here this section in the handbook that you could go to read more about that. And then they're also highlighted as to whether or not they are considered mandatory or highly desired. So when you're looking at the MECR standards, this is something where you're going to see this is a difference between a how do you do it standard and what PRISMA is, which is how do you report it. So sometimes people ask me, well, what does that mean when we're comparing those two kinds of standards? So for example, PRISMA will say in its requirement around the search, you must tell us all the databases that you searched and the platform that you searched them on. And of course, it lists more details than just that. Whereas Cochrane, they actually say you will search this, this, and this, right? So that's where we see a difference between how do you conduct the review versus how do you report the review. So here we see that they list Central, Medline, and Embase. And we also had, I think, a lot of questions around that. And they did put in the caveat in parentheses, if Embase is available to the authors doing the searching. And so they list that as mandatory. And then they also, the very next one is, okay, there's other databases sometimes that are important. And we're going to talk through that. Then we have a standard on how do you structure it. And then one saying, oh, if there are thesaurus terms, you need to combine those with keywords. It's highly desired to look at search filters and then justify the use of restrictions or limits to the search. And we're going to talk about these more in depth, but I kind of wanted to point out this table here. So last time we had talked through this case study, and I didn't put a lot of restrictions on this case study. I just gave you kind of 3 topics and they give you this list. So I wanted to make it a little bit more open so you could take it in different directions in your searches and you could kind of see as this develops what that would look like. And we had also talked about what's the framework, what more questions would you ask, where would you search? And so today what I'm going to do is I'm kind of peel back the curtain and show you some of the steps I do when I'm building up a search. And the other thing I want to say is the search that I have at the end of this is not a perfect search. The one issue in doing this case study is I didn't actually have a client who would give me feedback on it. And that's a usual part of my process. So this was just me making up a case story and then kind of working through a search. So some of you might have done much better searches than me. Because you might have kind of filled in some of these questions for yourself, and that's totally fine. What I'm trying to use this for is more about tools and examples of things that you could try in your practice. Okay, so here we go. So the first thing is in looking at this question, this is a PEO type of a question. We talked about this last time. So that's where you have a population, an exposure, and an outcome. So sometimes for this questions, when I'm looking to design my search, sometimes I would only do the population and exposure and pull down those articles. Sometimes I would add in the outcome, and I would normally never do that in a search, but sometimes we need to do that to get it down to a kind of a reasonable number. It really depends on what type of outcome that is. And then sometimes I might put in the study type, and I might or those together, or I might only do one or the other. So Meqor usually doesn't put, like I said, they would not put an outcome into the search itself, as for the most part, that would limit down their searches too much, and they almost are always only looking for randomized controlled trials. This was another slide from last time. So this is where we were talking about, okay, we're going to need a lot more information. So what do they mean when they say teens? I've had some groups, they would say, oh, that's 10 to 19. I've had other groups that would say, oh, that's, we want like 14-year-olds to 18-year-olds, things like that. So each of these concepts is going to have a scope in itself that it needs to have wrapped around it and decided on. And that, of course, you would get from your client's team. So here's where I'm expecting you might have lots of questions for me or lots of opinions, and that's totally fine. This is what I use and what we use in our team. So in this example, I'm saying we selected Medline to start, and my preference is Ovid, and I listed some of my reasons here. And I know sometimes there are questions around, well, does Ovid Medline really have all that Medline has in it? And so here, what I'm showing you here is a quote from a page that I got from Ovid that kind of talks through what they have there. So my reasoning for using Ovid is I feel that I can do more precise searching. I have a lot more options around, especially like adjacency kinds of searches, but also you have your wildcards, you have truncation, things like that, searching floating subheadings. And I find that to be, for the most part, more efficient. And so that's why I prefer to use it. Is also how I was trained when I first learned about Medline, when I first started out in medical libraries as well. So I know that that's a little bit of my own prejudice, you might say. So I think I have seen a few questions popping up. So I did log off at this slide to look at your questions. So let's see. What kind of search do you solicit? What kind of feedback do you solicit about the search, things to look for? Okay, so we can definitely talk about that. So things your patron thinks is a good search might not align with yours. I agree with that. We're going to talk all about search evaluation here in just a second. So thank you for that. Let's see what else you have. PubMed thinks it's smarter than you are. Yes. Sometimes I find that frustrating. Okay. So it looks like many of you are agreeing with me over the differences here. But, I also understand when people don't have access to it. And I've seen some, people who are great at overcoming the truncation issues with PubMed in their searches. So I can definitely understand that. Okay, so Sarah's asking about the differences between their coverage, and do I try and teach people how to search the other databases after the first search? Okay, great questions here. So let's go back to the slide and talk about coverage. I knew this was going to be a part where people had a lot of questions. And so when you say that, when that one question was about doesn't PubMed feed into Ovid. So Ovid is, of course, uploading PubMed's the information. They're usually a day or two behind at the most. And so you can see here that it's covering even the PMC books that are in there. And so you're right in that the coverage is similar. The difference comes to me in those added features that you could do on those more complex searches. And then the other question was around teaching your clients how to translate maybe, or even how to search. So sometimes it can be harder to teach somebody else how to do something than it is just to do it yourself. So to me, that really depends on your relationship with your clients and what you're trying to do there. For the most part, I haven't really taught my clients how to search. I feel like the thing I've trained them more on is how to tell me what they need and how our interaction is going to go. So the clients I've worked with for several years, they kind of know my patterns and the questions I'm going to ask and the things we're going to do. I have been lately thinking about training more graduate students on how to do certain things to give them a little bit more background on it, especially if it's for, say, their preliminary exams or something like that. It's something I'm still thinking about, where we're running some boot camps on systematic reviews, and we are including searching in there, but in some ways, it's more so when they come to us, it's not a blank slate. They've got some background. So hopefully that is helpful. So we'll get to your question on feedback in just a second. I would never search both PubMed and Medline. I know I still see reviews do that. I'm not always exactly sure why they do that. Okay, so let's move on. So here, I want to talk a little bit about team harvesting, some search filters and limiters, and then we're going to have our first interactive session where I'm going to have you go and look at either of the tools that I present that you want to look at, and then we'll come back and talk about them. So hopefully this is some fun here. So I'm not going to show the full development of all of these concepts. I'm using these to kind of highlight some different tools and kind of talk through them. So here our population is referred to mostly as an age group, right? And how you search for this is really going to depend on what the client says that age group is. So whenever we're seeing indexing on ages, they can think about them in different ways. So clinically, we think about them at their stage of development. So calling them adolescents, that's what we would think about. Sometimes they refer to them as where they're at in school. They're middle schoolers, they're preschoolers, they're college students, right? They have different ways. Sometimes they refer to them as youth, juveniles, minors. We see that sometimes from different disciplines, like in recreation and not sure, in urban planning, maybe they call them youth. So I'm still kind of getting used to that term. Reminds me a little bit of my cousin Vinny. And so then we know that in Medline, and here I just kind of took a little snapshot of PubMed's Medline's list of the different age groups, these are the age groups that we have to work with in there. And of course, their age group is probably never going to match up with any of them that are here, but this is what we're working with. I put a little bit of wording on here about how adults can be very tricky because a lot of times they don't, when they are working with adults, sometimes they'll just say, we were looking for participants between the ages of 18 to something, and they don't always put the term adults in. So I just find that to be kind of problematic. Okay, so let's say in this case that I'm trying to look around for somebody else who's already done a search on adolescence. And so this is a search filter that I found out there. And we're going to talk about search filters here in just a second, all the places you can go in this. They're also listed on the handout. But this is an example of, I went to go see, well, maybe I haven't thought of all the things. So I looked at this filter and so I started looking through it, and there were some things coming up that it's not going to be helpful to me, right? So the men, women, that's not helpful. There was young adults in here. There's younger in here. So I started taking some of those things out, and maybe I shouldn't have youngster in here. Maybe that's not appropriate for adolescents. Maybe that's younger. These are all things I'd have to work on with my client to kind of figure out. And sometimes going through the articles that come up would also help with that. But I'm just realizing now that probably youngster was not one for me to keep. Depending on how it's written up in your abstract, high schooler might be a way that they talk about this group. And so maybe there's not a space in there. And then later you see I have high next adjacent to school. So like I said, this is just all preliminary. This is something that I normally would have a client look at, I'd have peer reviewed, I'd get a lot more feedback than just doing this. But this is where I would also start thinking of, oh, what other mesh terms do I need to add in? That kind of a thing. So a lot of times we hear this word search filter, and I get sometimes questions around, well, what does that mean exactly? And so one of the Meeker standards, number 34, says, oh, it might be really good to use a specially designed filter if there's one out there, if it makes sense, right? So a search filter is just a collection of terms. Hopefully you can find one that's been validated, but those are kind of hard to find. Sometimes I find one that's not validated, but I start pulling from it. It's at least a starting point for me for some things. So they can be really helpful. So where do you find these? So on the handout, I put a list of 4 different kind of collections of these, with the very first one here being the ISSG filter database. And so they're trying to collect filters, whether they're validated or not, and some have been published on and some haven't. And you'll see study type, geography, age, lots of different things in there. And they organize them by the topic and then by the database. I also listed in here the CADITH one. That can be really useful. And I think I have an example of one of their filters coming up. I've also used the BMJ search filters. They have been really helpful for me because I can always find them really quickly. And then, of course, I also listed Cochrane's here. And so because Cochrane focuses on randomized control trials, that's what their filters are about. Okay. For the next topic, the screen time, this is the one that I would worry about missing the most terms on. So this is where I could, of course, they gave me those 6 articles. So I started highlighting, okay, what are some terms in here that might apply to the screen time concept? Some of the terms that we see here may be going too broad for this group, and some may be really helpful to add in. So this is where I would need to talk with them and see what they're thinking about. And so last time we used the tool, the Yale Mesh Analyzer, and here I just kind of highlighted. So we could go as broad as computers, which I think is probably way too broad for this group, or I think internet is in as well. And social media might be a little bit too far. It just depends on their take and what they're looking for. So I tried to highlight in here the terms that came up that I would talk with my group about. And I also thought here, I wonder what Copilot would do. So I tried two different prompts here. So the first one, I just said, list synonyms for screen time. And here what you can see is this is more referring to I think like time on air or something like that for broadcasting. So I was like, that's a little bit off of what I'm looking for. So then hopefully you can see this in the next prompt. I gave it a little bit more context. And there I started getting more things that might be helpful to add in to my topic. And so I think that over time, this might turn out to be a useful tool. But we're going to have to learn like how to engineer those prompts. And I know there's been people doing a lot of good things around this is how you engineer it. So this is just my I'm just starting out trying to figure out what are those things I need to put into Copilot to actually give me some good ideas here. But it did give me some. The next topic, this one was depression. And for this one, I thought we would talk a little bit about the mesh terms. And we talked about mesh headings last time as well. Depression is always kind of a little bit of a tricky topic in Medline to me because there's two ways that we'll see Medline kind of refer to it. So one way is kind of this term depression, which falls under symptoms. And then in another way, we see it depression where it's as a diagnosis. This is where when we go to translate into another database, like APA PsycInfo, that's where we're going to see a big difference between the two databases. The source is, of course, PsycInfo is going to have a much richer area around depression. And this is, of course, where I would need a lot more feedback from my group in that there were some headings. I can kind of switch back real quick here. Maybe you can see some of it. There were some headings in here like mental health, well-being, like some other terms that would kind of expand on not just depression, but all of mental health. So getting into anxiety and other things. And that's something you would have to talk to the team. Do they want to go that broad in their thinking, or do they really only want depression? And so, and do they only want clinical depression, right? So we'd have to, that's something you would get from the team. Okay. So the next thing is kind of thinking about those limiters. And so here, this is the fuller description of what MECOR is talking about. And they really only talk in here about two limiters. The other limiter that they always say is Cochrane always says don't limit to English. Of course, many times our group asks for that. And so I will do that, but I just always let the group know that sometimes journal editors might come back and say, oh, you limited to English, that's a publication bias. And so it's just something for them to be aware of that could happen. And then they're going to have to speak to it in their limitations. And we're going to talk a lot more next time about writing up potential publication bias for the paper, because you might be asked to write a couple sentences on that. So here, Cochrane's advice is that the search should only be limited by date if there's a really good reason for it. Now, remember, this is just for Cochrane's purposes, right? So if your group is doing, of course, not a Cochrane review, but if they were doing, say, a scoping review or something else where it's more, maybe not a comprehensive search, but more of a sampling search, of course, we're going to limit by date if they were updating something. But for the most part, I haven't seen too much kickback anytime we've limited a systematic review to a certain date, because most of the time we pick a reason why and we can justify it. This is just what Cochrane says for them. Cochrane also says not to limit to publication types. Of course, we still have groups that will ask for that. Sometimes I do point to this standard, especially if they are focusing on interventions, but for other types, it may not be as vital. But I will always talk to them about it potentially being an issue. I put this part in here just because it does come up sometimes in searching. For this one, I don't think I'd have to worry too much about limiting to humans. But it could happen that something comes up that is about animals. And also sometimes groups ask me to limit just to US. And that is one of the most difficult things to do. And for the most part, I always tell them there's probably nothing we can do about that. You're going to have to do it in your screening process. And of course, one reason is that people describe geography in all different ways, if they do describe it at all. And this is where looking for especially a validated filter on any of those is really helpful. So I put in here, maybe some of you have seen the Cochrane's limiter, which is pretty short. It's like explode animals, not humans, and then you knot that one out. This is a little bit longer one from Caddith. In our practice, we use kind of a version of this one plus a little bit of other terms that we found to try and limit it down a little bit more even than what Cochrane does. So it's good to see like what other people are doing. And depending on your topic, you may not need to go this far with your limiter to humans, but we always know that if you just check that box in PubMed, that that's an issue. So put that out there. Okay. So now we finally get to the part where we're combining everything together. And so, so here you see taking that, the mesh heading adolescent, putting in those keywords, doing screen time. And so I'm kind of working through this. And now this is where I would want to talk to my team, get some feedback. And so I try to get feedback in a couple of different ways. And we're going to talk about evaluation here, but I know there was a question in the Q&A about this. So I would show it to them and have them ask me questions. Sometimes they will ask to put things into the search that I know would be problematic. Depending on the client, I might put it in and then show them why I'm saying it's problematic. Sometimes, like I said, depending on the client, I might just talk them through it. So I might not have to show them. I know I had one time I was working on another review that was around depression, and they had wanted me to add in the term sad. And then they're like, oh, well, let's just put sad with an asterisk for sadness and all of those. And I said, well, we can put in sad or sadness, but we don't want to put an SAD asterisk because there's just too many other words that start with sad. So I will always talk them through what we're trying to do here, why I'm making certain suggestions. Sometimes they'll want to add in terms just because they've seen it in a lot of their papers, but it doesn't have anything to do with their concepts or their search. And so it's just a matter of keeping that communication going and talking them through it. Of course, there's still a lot of synonyms I need to put in here. There's nothing about digital. There's nothing about video games. So still need to do some more work in here. I did put down here at the bottom, it's probably a little too small maybe for you to see, but while developing this search, one issue that might come up for you is if you do the search for screen use. So use is one of those stop words in Ovid Medline that is like an action term, just like and or things like that are. And so if you're trying to use the term use, you've got to put it in quotation marks. So I just kind of added that little error that you might have seen come up for you. Another thing that you might have a question on is why those three fields I searched, like on line 2 or 4. You see I searched title, abstract, and the keyword field, the KF. So I used to always do KW, but what we found is that KF can help to get even more. And I wish that Kyle was here today. He's on vacation. He explained it to me, so hopefully I can say this in the right words. But he was saying that the KW field is phrase indexed, where KF is more open and it's more by the word. And so we found better luck searching with KF. That's a recent development that we just started doing in the last several months. So I always did KW before. I started adding that in instead of just doing title abstract because it also gets to those author keywords. And I found that to be really helpful, especially for newer topics where there hadn't been a mesh heading yet. I found that to be very helpful. Okay, so now we come to our first interactive part. So hopefully you find this fun. You can pick one of these two options, and then I'll give you about 5 minutes, and then we'll come back and we'll talk about this. So either go to the ISSG site and kind of check out how it's laid out in there, maybe even look up a filter that you might use for the search we're on now. Or what if you go and try and build a better prompt than I did to get AI to give more screen time synonyms, or maybe you're working on a search right now and you need some synonyms for that. So hopefully those can be pasted into the chat, the link for the ISSG. Whichever AI you want to use. I'm not saying anyone in particular. I know our university uses Copilot. And so we're going to take a little break here, and let's come back in 5 minutes or so. And so that will be, let's see, let's say 1:43. Maybe we'll just round it up to 1:45. And while you're working on that, I'm going to go through the Q&A and the chat and see what other questions you have. So, sometimes I don't have my link to the ISSG search filter site right on hand. So I know that if I Google ISSG search filters, I put that in the chat. It usually is like the first link that comes up. So hopefully, if that doesn't work, that works for you. And so I did see a little thing about, are we saying these are equivalent? No, these are two very different tasks. So ISSG is an international kind of repository of search filters. They're trying to collect things. And then AI was just give yourself a few minutes and see if you can build a great prompt to get synonyms. So I'll leave you to it. Okay, so we have a few more, maybe one more minute here. So thank you for all of your questions that you put in. So I kind of start with that and then start getting your feedback on whichever tool you tried to look at. So one question that I saw was to try and explain the difference between KW and KF again. And this is where I feel very inadequate in explaining this, but I will try. So what we found was that KF is a little bit more inclusive in the search than KF is. No, it is more restrictive. So KF is more open, and therefore that's the field where we choose. And so KF is searching by the word, and KW is does some phrase searching. So it's a little bit more limiting. They're not drastically different. And hopefully when Kyle is back, we can have him as our guest speaker next time to talk a little bit about it. So Kyle is my assistant, and he really did a deep dive in this spring and summer into different fields. And we did a lot of kind of practice with some of the different reviews we're working on. So if somebody has a better explanation and you put it in the chat, thank you very much. I do not feel like I'm expert on those two fields there. Okay. Another question I saw was, could I use two filters? Maybe like RCT and cohort. And yes, I have done that before. So I've had groups where they said, we'll take randomized control trials, cohorts, and like case control or something like that. And so then I've used the filters, and then I've just kind of ordered them together. It can also be really helpful if they're doing kind of a scan to find out, well, what studies are out there, because because then I could limit my searches to those different groups, and it gives them a quick idea of whether or not it, and looking at the different studies, what they might want to do for study type. So I have also used that in kind of some exploratory searches. So really good question. Another question was, would I cite it? So if I used, say, Copilot to help me come up with some synonyms. So I don't know that I would necessarily cite it. I'm kind of using it a little bit like a talking dictionary in a way. Because I wouldn't just use the terms that I see there. And there's also, it didn't like design it or anything. So I don't know if I would necessarily cite it. I could see when you need to cite it, like if it was helping to write something or something like that, but I'm more using it more like a dictionary or Google search. Hopefully that makes sense, what I just said there. And then I love teaching webinars because I always get new information. So Arpita had written into the chat that the last human-only abstract in Medline was in April 2022. And would I keep doing what I've been doing? And for searching Medline, then I think yes, because so if they stopped marking things as humans only in 2022, that still leaves a lot that have been marked with that. But that's really interesting. I would really like to look into that because I hadn't necessarily heard that. Okay, so hopefully I answered some questions there. We're going to get to the one about feedback in just a second because we're going to get all into the evaluation. So let's see what y'all thought about this here. So, wow, y'all have lots of things in here. Let me see. Just trying to scroll in here. And so people talking about using AI. Oh, thank you for putting in that blog. I'm definitely going to go read that. I'm sure it's a better description than me. Let's see. Some synonyms for screen time. Wow, that's really good, that list there. Oh, lots of people pasting in about KF. Thank you. So tried using their branded AI and found it frustrating. I've seen sometimes where I've seen some prompts where they say something like continue to list synonyms until I say stop. I think I've seen that from someplace, but I don't know which AI they were doing that in. So, man, this is going to be a treasure trove for me to go through here, all of these terms that you found. This is really interesting. This is great. Microplastics, wow. So I think what we're going to see over the next year or so is people coming up with better ways of asking AI how to give us these. I don't think that it's going to keep us it's going to answer all of our questions or anything like that. But I just think it's another source that we can look to. And so I was just trying to show in my example how it helped once I put some context with it. And I didn't just say screen time. This is definitely something that my team is going to be looking at just to see, like, is it really useful, or do we go back to what we were doing before? But thank you for all of those. That was really interesting. So hopefully you enjoyed this little trek into these tools. And let's move on to the next. Okay. So in evaluating the search, there's basically 4 ways that I could really think of in evaluating the search. So one of the first things that I do a lot of is, does it include X, this whatever article it is? We can also look at measuring search performance. And I have some of the equations there and some articles if you want to look at those. A lot of times what I do is I'll give the group the first 100 to kind of sort. And we talked about that in our during the proposal phase as well. That can be really helpful to get some feedback, or especially if they don't have very many articles for you to check the search, that could be a way of getting that in. And then of course there's always peer review, which I have found to be really helpful in pointing out issues. And I'm sure all of y'all can point out issues in the search that I did as well. So when I'm working with a client, I will give them, like I said, those first 100, have them sort it, look for potential studies. Also, I also ask them to look for additional terms that we could add into the search that maybe we hadn't thought of before, especially if it's like an international article, because maybe we've thought of the Americanized way of thinking about that topic, and maybe in other places they're saying it a different way. And you can kind of see that if you look through the 6 articles I picked out as examples that maybe this imaginary project we're working on might pick, because some of those are more international as well. And so then this is an example of how I usually present searches to groups. I usually try and group together the terms for each concept together. And so here you can see I started adding in, added in some more mesh headings to try and get at adolescence, added in some more terms around screen time, and then also around depression. In this example, I'm just making up that they said, oh, let's include all things about mental health. And so I started adding in those things. And so you can kind of see some of that work there. And I'm going to go on to the next here. And so what about Article X? And so this is where that team brings you that article. And sometimes they'll say, why isn't this in the search? And so the very first thing I'll do is I'll go and check the search, because sometimes they will mark it excluded very early in the process. It could be that the abstract was just not written well. And at some point they found that article and read more into the full text. And that's when they realized, oh, I really want this. Sometimes we haven't searched that database. Sometimes it just does not match up. I'm like, why are you trying to put this cohort? You said you only wanted randomized controlled trials. So this is, where I'm trying to avoid that scope creep. And so I tried to put in these pictures because I found it really funny. I was like, oh, Copilot can make pictures. Maybe I can add a picture to the slide. So I said, design a poster with a tagline, only you can prevent scope creep. And this is what it gave me. It's so funny that it didn't ever spell out the thing I asked it to. So hopefully that gives you a little laugh today. Okay. Oh, the other thing about the Article X is sometimes it does have a synonym in there that you might want to add. So that can happen. So here on this slide, I'm just trying to demonstrate how I try and look for, does the search include X? And sometimes we have multiple X's to search at the same time. So this is just my example of doing that. So line 10 represents all of the results that I have right now. And line 11 is the 6 articles they gave me. So I'm searching those by PubMed ID. Line 12, I'm trying to say, hey, did we find all of them? But I only got 5 back. So I know, okay, one, I'm missing something. And then, so in the pink lines there, 14 through 16, I'm just going through each concept and seeing, am I getting back all through that concept? That just helps me to know which concept do I need to go back and focus on and make sure that I have everything around it. And so, so with adolescent, I got 6 back. But with the screen time terms, I only got back 5. So I know that's the one I want to focus on. And so that's when I would go and look at it and say, okay, what in the title or abstract or mesh headings matches this concept? Sometimes I do it and I see very clearly, oh, I did not put screen-based media into my search. So I'm going to add that. Sometimes maybe it just said internet or computer, and it didn't say anything around time or exposure or anything else. It just said those words. Sometimes it's not worth it to try and get that one article in, because let's say I add in that broader term and now I get back 10,000 or something like that. Probably wouldn't necessarily happen in this case, but maybe it does. So that's where I go back and forth with a group and say, okay, I can bring this back, but because they use this generic term, this happened. So hopefully this makes sense to you. How I work through this. I know sometimes people just look at the one that didn't come up and they'll just kind of scan it for which reason. I like to do it this way because I like to know why I'm looking at the one and what I'm focused on. And it could also be that it's more than one reason why something doesn't come up. And it's also important to, if you don't see something come up, but it comes up with all the concepts, it could be because you have a limiter in there. So I know one time, sometimes I've seen it, oh, wait a minute, it's from 2009 and you said you only wanted 2014 forward or something like that. So it may also be important to look at whatever limiters you have as well if you're not seeing it. So I added the term in, and then I got some more back. And so the reason why you're doing this, of course, it's not just to get that one article, it's to get any other articles that are also like that. And so you see, not only was I missing that one, but potentially 4 others as well, because I got 6 more back. So, okay. So a little bit about search performance. I think the trickiest thing about doing systematic reviews or any type of search where you're trying to make sure you're being comprehensive is we have no idea how many things we're supposed to get back, right? So we don't know if there's 20 studies out there. We don't know if there's 80 studies. All we can do is all we can do. So it's a little bit unfair sometimes to do like a search performance kind of calculation on it, just because we just have these tools to kind of sift through. But there are some measures out there, and sometimes people do this. You'll especially see these measures when they're looking at search filters, and they're usually trying to balance sensitivity and specificity. This article itself that I put here at the bottom is from Jenkins. Has one of the best pages I've ever seen on really going through those calculations and what do those different terms mean. So here you see they have sensitivity, precision, and specificity. And so I wanted to add that in here. If you're curious about those, you could go and see that. And then we see this, I put in this quote here from the Pimentel in 2005, just because I felt like, oh, this really explains and puts this definition, helped me. So hopefully you find that as well. And then, of course, there's an all-important peer evaluation. And I found this to be very helpful. Sometimes I'd make spelling errors or answer ors are off. And then sometimes they've done a search similar to what I'm doing. And they're like, oh, there's this one term or there's this mesh heading you don't have here. And so it's really good to find a community that you could work with. So maybe it's a local group that you kind of exchange things with. And so you feel very comfortable sending that to them, getting the feedback. And it's really important to also give them the eligibility criteria and what you're going for there as well. Sometimes it can be tricky because then you have to explain, oh, well, the group didn't want that or something like that, but it's all good. It's good to get that feedback. Okay. So let's see where we're at with time. So we got about 30 more minutes, and let's see where y'all are at. So we talked about feedback. So how often do I do the measure? So I don't necessarily do the search performance measure that often. Just sometimes it's a question around searches. The one I find the most interesting is the number needed to read, which is, I can't remember which one it is. So y'all will probably correct me, but it's the inverse of either, maybe it's the inverse of precision, I think. So it's basically how many things do you need to read before you get to one that's good. You'll see a lot of times, and I did this in my thesis where I looked at, I think it was 60 systematic reviews around a very specific topic. And their precision was like maybe it was less than 1%. And that's very typical of the searches we're doing. But I don't think that we have to feel bad about that because we're not going for being specific as much as we're going for being sensitive for the most part. So, but I think it is definitely a balance. Okay, so I'm going to move on because I want to make sure we get through the next set. So let me do that here. So a little bit about translating and deduplicating. So probably most of y'all already have your method for naming things. This is my way of naming things. And definitely next time we're going to talk a lot more about documentation. We're going to go all through the Prisma search report. So we're going to have a lot about that. So with my team, we have a convention for naming things, and this helps so that any of us can go into a folder and see results there if we need to. And in this case, I'm showing that we have batch numbers. That's because sometimes databases only let you download a certain amount at a time. And so we have found that we've got to put batch numbers in some of our searches. And then we also save the search within the interface we're in. And we have a shared account because we have an email that's just for our service. And that's how we signed up for a shared account within Ovid or EBSCO. And this way we can also use a very similar convention for naming searches. So that helps that if one of us is out, then the other one can go and run a search and send it on. But I also copy and paste the search somewhere else because I have had, I have lost access to saved searches in vendors before, and I never want that to happen again. So I download it as well. The next part is in thinking about what databases are you going to select for it. So we already talked about what Cochrane says, and then we also know in our areas those databases which make the most sense, right? And so a big question I get a lot is how many databases? Well, there's no right number. It's more about have you searched all of the appropriate ones? Something like it's more around appropriate than any certain number. And so for the most part, I feel very comfortable in, like, I can list them off usually pretty quick because I'm very familiar with that topic. But sometimes there's some topics like sometimes it's an engineering/medicine question, and I'm not as comfortable all the times with those. And so sometimes I've wondered, what other places should I search? So this is a new tool. I just found out about it. So I don't know everything about it. So I'm just going to say that right now. But I thought this would be a fun one that we look at in a couple of slides. We'll do some time to let you play with this a little bit and see what you think. So this is called Smart Search, and it was designed to help in the selection of databases. So it compares the number of records in a database that match a certain topic. So of course you can have a lot of questions about this, and so do I, as to how they do it. And they do a pretty good job on this of answering questions about how they built it. So like I said, I'm going to give you a chance to go play with this in a minute, but just a little bit about how I've used it. And like I said, it's been less than a month. But what I did for my purposes is I went in and I did a search. It was on agricultural topics and also had an economic question in it as well. And so for that, I said, okay, give me, I'm looking for databases that help with systematic keyword searching, and I have a certain subjects that I'm looking for. And I left it at scholarly records. And then the next thing it lets you do is you can pick 6 databases. This example here is not the agriculture one I was talking about But the agriculture one, I needed to use it to help me justify why I picked certain databases. In this one, I was picking psychology related ones because I was acting like we were doing this for the case study. And so in this case, this is comparing Academic Search Elite to APA PsycInfo and showing what it considers the subject coverage of psychology for each of those. So we can see that APA PsycInfo, not surprisingly, has almost 1 million more records around psychology. It also shows you the relative amounts within there. So for example, for agriculture, Agricola has, most of it is about agriculture. So the relative amount would be much higher for that one than, say, Web of Science, which may have almost as many records, but it's a very small percentage of its overall content. You'll kind of see that when you get a chance to play with this, what that looks like. So in this case, this is one of the screens that you can get once you mark items you want to compare. This is comparing these 6 databases. And I marked out all the other topics that it could show me so it could just focus on those 2. And looking at their sizes. So how much is there and then how much of it is covered on that topic. So like I said, for a lot of times, you may not need this for the topic that you're doing. You might be like, oh, we need Medline, Embase, Cinol, and ERIC or something like that. But for things where maybe you have to justify or something like that, maybe this tool is helpful. So I'll give you a chance to look at it in just a minute. We're going to talk a little bit about translating. So translating between databases can sometimes be a little bit tedious, right? So as you go between the different interfaces, I'm trying to keep the keyword searching as much the same as I can. Of course, different interfaces don't always offer all the same options. I may design my searches for the different databases, but all within one interface around and work through those first. Of course, I'm not going to search them at the same time, but I'm designing them because I don't have to switch syntaxes at least. There is a tool called Polyglot. When it first came out, I looked at it and I said, oh, it's not for me. And I didn't go back to it for a long time. And then when I started building up my team, we looked at it again and we found it to be more useful than I thought. And it's a great starter for this. So I'm going to show you a couple of slides about that. And then we're going to have a chance for you to try it out and see what you think. So what I did is I took this example that we've been working on and I pasted it into there. You have the option of leaving the numbers in there, and then you have, I kind of highlighted in red here, this little box, which says replace line references. So if I leave them in there, then I just check that box and it will figure out where the numbers need to be. I didn't realize that as much before when I first did this, so I'm learning better how to use it. But that is a feature that it has. So once you paste in a search, then what you do is you can scroll down and you can see the options. So it doesn't have like all the options that you probably want on here, but hopefully there are some that you would find helpful. The one that I personally find the most helpful is the Cochrane Library one. I still feel a little bit clunky when I go in there and I'm trying to find the mesh headings. And for me, this really helps with that part of it because it gives me those mesh headings in the format that it wants it to be in for the Cochrane Library. And so I'm more quickly able to translate my searches there. And then, sometimes I may be searching a database that's not here, but maybe it has, like, for example, APA PsycInfo, that's an EBSCO search, but it does have Cinol EBSCO. And so that will at least get the keywords maybe where I want them to be. And then I still need to search up the source terms. So it's not perfect, but it definitely has helped a lot. in the process for us. And we're still kind of working out, okay, which ones is it best for? What do we have to go in and fix? And so we're building up a list of suggestions that we have for people and using these different tools I'm talking about here. I'm hoping before we're all done with the webinar that I can announce where this wonderful list of all these suggestions we have is going to live. We're building it right now. And so stay tuned for that. But hopefully this is a helps you. Okay. Deduping. Oh my gosh. If there's anything I've had clients complain about the most besides why do we have to go through all these articles, it's around deduping and why is it such a problem. So I put 3 articles here talking about deduplication, different approaches, different things. And so Vicar Brommer had his series on systematic review practices, and he had this article which I had been using for a while on how to use EndNote for your deduping. And then once we really started getting more into Covidence, we started using that more as a deduper. And I always wondered, is that the best thing? Should we be doing that? And then I feel kind of happy that that is pretty much what we've been doing and that these articles are pretty much saying, hey, Covidence does pretty good. So that's kind of the one that's in yellow there. And then the same group that does the polyglot one, the Systematic Review Accelerator, they also have a deduper. Now, called the deduplicator tool. We compared, Kyle and I, we compared these on several projects. We compared following the EndNote deduping practice. We tried the Systematic Review Accelerator deduplicator, and we also used Covidence. What we found was that Covidence worked the best for us. I know not everybody has access to it because it does have a cost, but that's what we have found works well for us. What I have here on the screen, this is the deduplicator. This is from the same team, like I said, that does the polyglot, the translator that you might think about using. And so we found it to be helpful, but there were just other steps that had to be done in there where Covidence, it's just kind of a one-stop shop for us where we put it in there, it does a deduping, they got their Prisma flowchart going, so that really helped us. But I wanted to present different options, including free options in here, depending on what you have access to. And so let's do one more little interactive here part where you get to pick one of these tools to go and try. So if you'd like to try the polyglot, that's the one for translating a search. So if you have a search, you can paste it in there and then see what it does. Maybe you could go and create a quick search, a couple of lines and just see how it works. Or maybe you want to try out the Search Smart tool, and that's the one that was for helping pick out databases. Now, I will say the one thing about it that I found kind of frustrating when I first started using it, let's go back real quick here, that it has a button in there where it looks like, oh, I can put in a keyword and it will tell me on all these databases which one was best to use. It doesn't exactly work that way. You have to pick from their list of keywords, and it's a little bit weird, the ones they picked. I found that it works best when you just pick subjects, so I will put that out there to stick with subjects for right now. Hopefully it continues to grow and they figure that part out. Okay, so we're going to take 5 minutes here, come back at 2:20, and let me know what you think. And in the meantime, I'm going to go through the chat and the Q&A and see what other questions you have for me. Okay, so what did y'all think? Whichever one you tried. I think I saw a little bit about what you were trying. So library science, seems like was not a concept in there. And so I agree that they're kind of definitely some areas overlooked in what they did. For engineering, yeah, I found that to be interesting. And polyglot, like I said, when it first came out, I was like, meh. and I found it to be frustrating, but now I'm starting to see like definitely in some translations, it's extremely helpful to me. So hopefully if you hadn't tried it before, you might find it helpful. So, oh, lens.org. I don't know a lot about it. Um, and this is definitely uh, another thing that I've learned from working with that tool specifically, that there's some databases I hadn't heard of on there. Oh, lenses for patents. Okay. So definitely might be useful in when we get into the gray literature. So patents is not something I normally have to search for, but I know as we start getting more engineering/medicine ones, we might need to do that. So yeah. Okay. Well, I think that y'all are definitely right about the transcript. It is going to be a wealth of information to look at. Okay, so I don't have many more slides here. Thank goodness, because we only have a few more minutes. So I just have like a few slides left, just a little bit about gray lit. And as promised, the next time we meet, we're going to go through the gray literature and other search strategies. And we're really going to get into some more specifics. So this is kind of like just like a preview. That's it. It's a little trailer of what's going to come the next time when we talk. So this is a little table kind of summing up what the MECOR standards are. Of course, this is just what Cochrane says to do. There's other things that we might think about doing depending on our topic. So for example, patents is not something necessarily listed here. And for some topics, maybe it would be a very useful place to look. So here we see, of course, they talk about searching the trials registers. They do list gray literature, and so they list lots of different things, but there's definitely other things that we might think about. Then there's two standards around looking at reference lists. I've always wondered the difference between 29 and 30, as both of them do talk about looking at reference lists of previous reviews. But I found those two things to be extremely helpful. And then the last one is around contacting, sorry, not conducting, relevant individuals and organizations. And so next time we'll go through each of these slowly and we'll talk about some tips and places to search, and also share some stories and things I've learned along the way in these last several years. Okay. So of course there's challenges around this. So sometimes your team is like, no, I don't want to do any of that. Sometimes they don't have great exporting tools available. And then so that can cause an issue when you're trying to put it into Covidence or some other tool. And then the big question, when do you stop? And this list of questions that I put here is kind of from an older book, but I still think it can be helpful. Like when my clients keep asking me, like, when do we stop? So this is just an example of something I've seen. So they were like, well, have you identified all the reference databases that you need to search? Do you not have any systematic biases like non-English and things like that? Of course, sometimes my team still want to limit to English. Have you looked at, those prolific authors on your topic? And to me, this kind of gets to that contacting organizations, things like that issue. And then did you modify your search strategy based on any of those things? And so this is a topic we're going to get really into next time about this process, but I just have a little picture here talking about, we go and we screen what we found from these other searches, and then we say, oh, do we need to modify the database? And so we're going to talk about that situation because it happens really often, and we're going to walk through when to modify and maybe when not to next time. So we'll get into a lot of specifics. Like I promised, it's just a little sneak peek and we'll get into all the details. So while you're doing all of this, right, your research team is continuing to process things. Sometimes I refer to it as we built the factory and now they're actually doing the production side of, getting everything out. And so maybe they've decided to, oh, this is supposed to say present. Sorry about that. Present the preliminary results. So there's a couple of guidelines that they might think about. So there is a PRISMA standard just for abstracts. So that might be helpful when they're trying to submit that abstract to a conference. And then there's also a Cochrane template that's for posters. And so I thought that was kind of cool. So you can actually have templates that you can download. And so might look at that as an example to kind of help them if they're doing a poster. Like I said before, I usually try and talk with them about not setting up unrealistic expectations for getting things done. And so that is the end of my slides. I know it was a lot in our 90 minutes. We have a couple more minutes here, and I know that Margie has some things to say. Okay.
Sorry,
Thank you for that explanation about the slides there, Margie.
Yeah, sure. I kind of lost a little bit of track for the Q&A, so I just want to make sure we peek at that one more time before we.
Okay, I can look at it one more time. Let's see, there was a question about my pieces spreadsheet. So you still remember that, Nancy? So I am working on an update. It's going to be available as a Google Sheet. I'm hoping before we're done with the webinar that I can give y'all a peek into it. I'm being a little bit of a perfectionist, so it's not quite there yet, but I am working on it. And then Beatrice asked, did you cover this in your book? I'm not exactly sure what you mean by did I cover it, because it's a big book. But there are definitely some tools that I'm talking about in this webinar that I didn't use before. So I think that's going to be continuous evolution. So next time I'm going to put a lot more time in for more questions. And then our very last session will even have more time because I know y'all might have been building up on some questions as well. Oh, you still use my spreadsheet. Oh my goodness. I'll make sure I need to send it to you then to get your feedback if you're still using the old one.
And then I guess there was a question about your book. So I'm assuming your book covers a lot of the information that you covered today.
Oh yes, I mean there's and then there's a lot more detail, and then there's topics in there that better experts than me on that topic wrote it. One of my favorite sections in there is our chapter has lots of examples of searching and different types of questions. There's also a chapter on visualizations and tips and tricks that you can use with your clients on that. So those are two areas that I don't necessarily feel expert on. So I was glad we had other people to write that. So thank you for coming today.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.